what is lymphedema, we all nurses. So you might have seen lymphedema at least once, but sometimes we stuck somewhere. If we have seen lymphedema, how can we manage? So that is one of the major difficulty for the nurses facing. So we have seen many patients in palliative care with lymphedema. We learned few things how to manage lymphedema. So that thing I'm planning to share with you all. So let me share my screen first. Hope my screen is visible to everyone. Can anyone please confirm?
Yes, ma'am.
Yes, ma'am.
Thank you. So throughout our lymphatic system. So the lymphatic system is a part of our circulatory system. So before moving on to the lymphedema, so we need to that recap some of the points in the lymphatic system so that we can able to connect with the lymphedema. What is lymph? Can anyone say what is lymph? So throughout the lymphatic system is flows lymphatic fluids. What is lymph? Anybody? Any idea?
Interstitial fluid with the protein.
Interstitial fluid. Very good.
The protein and
So, thank you. It is a tissue fluid or an interstitial fluid is collected through the lymphatic capillaries, then enters the lymphatic vessels, then it goes to lymph nodes for filtration, and then it goes to the subclavian vein. So after that, it's a part of circulatory system. So it contains protein, lipids, and water. It's a tissue fluid, it's an interstitial fluid. The fluids will be situated in the interstitial space. What are the major functions of lymphatic system? What are the major functions of lymphatic system? If anything happen in our lymphatic systems, so any problems develop in the lymphatic the system, these all functions might be affected. So we have to understand that what are the major functions of the lymphatic system. What are they?
So maintenance of fluid balance, ma'am.
Very good. So it's maintenance of fluid balance, because whenever the tissue fluids or interstitial fluid enters in the interstitial space, the lymphatic capillaries are the responsible things for absorbing the extra fluid from the interstitial space to then it enters to lymph vessels. Finally, it goes to subclavian so that we can able to maintain our fluid and electrolyte balance. Very good. Is there any other functions?
carrying fats and proteins.
Very good. So in our small intestine, we have some small villi. So in the especially in the small intestine, they are responsible for the interstitial fluid absorption and also the absorption of fat soluble vitamins. So transport dietary lipids is also another function, major function of lymphatic system. Another important function of lymphatic system is lymphocyte development and the immune response. So this is very, very important. So just keep it in mind. If anything happening into the lymphatic system, that one place, that area will be more prone to develop infection because there is no lymphocytes are there to fight against infection. Okay, so the lymphocyte development and the immune response is the major function of the lymphatic system. So you all know that our systemic circulation. So here we know from our upper part of the body, the superior vena cava, will be so superior vena cava take the deoxygenated blood from the upper part of the body, and the lower part of the body, the inferior vena cava will be taking the deoxygenated blood. Here, just see that upper part of the body and the lower part of the body. There is a connection between the arterial capillaries and the venous capillaries. Clear? So, in the lower part of the body also, there is a connection between the arterial capillaries and the venous capillaries. From just you can look into the lungs. There also from the when the right atrium will with the help of the tricuspid wall, that deoxygenated blood, it goes to the right ventricle, and then through pulmonary artery, the blood will go to the deoxygenated blood will go to the right and left lungs for purification of blood, right? So here also the arterial capillaries and the venous capillaries are communicating together. Clear? So this is our that systemic circulation. So why I am highlighting this picture here is we have to understand that there is a connection between the arterial capillaries and the venous capillaries. Okay, so there is a connection between the arterial capillaries and the venous capillaries. Clear? So next, just you can see whenever our arterial capillaries and the venous capillaries are communicating together, there is a chance of leaking out of fluid-like substance into the interstitial space. Clear? So, whenever or wherever the arterial capillaries and the venous capillaries are communicating together, there is a chance of leaking out of fluid-like substance into the interstitial space. So that is called lymphatic fluid. Okay, so you can see that greenish color in between that arterial capillaries and the venous capillaries. So that lymphatic capillaries are the responsible that capillaries for absorbing the extra fluid from the interstitial space. Clear? You can just see this picture. It look like a clustered form. Okay, so wherever or whenever that fluid will be absorbed, the leaking from the arterial venous communication, so that fluid will be absorbed with the help of a lymphatic capillaries. So coming to the lymphatic capillaries, it has a blind end. It has a blind end, single layer of overlapping endothelial cells, more permeable than that of blood capillaries. It is more permeable so that they can able to absorb little bit more that big molecules also. Clear? Coming to the intestine, small intestine, again there is a capillary lacteals. So we already discussed the special type of that lymphatic capillaries called lacteals are there. So there is also the major function is to absorb the interstitial fluid, and also they dietary lipids and the lipid soluble vitamins also pick up from there. So here what we need to understand that if we ingested something, sometimes if there is toxic products is also there, toxins will be there. So our intestine, we have lot of lymphocytes, so they will be the responsible person, the thing for fight against the bacteria. Clear? So here, if there is any problem develop into the small intestine, so these functions might be affected. And also that because of the mixing of fat soluble vitamin into that small intestine, So it looked like a milky color, that lymphatic fluid there. So we used to call chyle. Coming to the lymph nodes, we already discussed about the lymphatic capillaries. It has a blind end, more permeable than that of blood capillaries. It is over the look like a clustered form. So they will be overlapping into the endothelial cells. So after absorbing the fluid from the interstitial space, uh, the lymphatic through the lymphatic capillaries, that it goes to lymphatic vessels, and finally it goes to the lymph nodes. So it's around 600 to 700 lymph nodes in our body. So it looked like a small round or oval shape located along the pathways of lymphatic vessels. Approximate length is 6 to 25 millimeters, typically found in clusters. The main function of lymph node is receive lymph from the many body regions. So lymph nodes are also found individually throughout the body tissue. So the main function of lymph node is filter out the harmful substance from the lymphatic fluid. So the major function of lymph node is to filter out the harmful substance from the lymphatic fluid. So just imagine this, just to see this picture. Okay. So as I discussed earlier, this is our venous circulation, this is our arterial circulation. So the arterial capillaries and the venous capillaries, the arterial capillaries and the venous capillaries are communicating together. There is a chance of leaking out the fluid, the extra fluids drained from the cells and tissues. So you can see this greenish color, green color, that is lymphatic capillaries. Okay, so it looked like a clustered form. So that will be overlapping into the endothelial cells. So that will be absorbed the fluid from the interstitial space, and then it goes to the lymphatic vessels, and then it goes to lymph node for filtering out the harmful substance from the lymphatic fluids. Again, it goes to lymphatic vessels. If there is any another lymph node is nearby, again it goes to the next lymph node. Again, there is a second filtration is happened. Finally, it goes to the collecting duct. Through that, it enters to the subclavian vein. So you can see the next picture. So here, there is a communication between the arterial capillaries and the venous capillaries. The lymphatic capillaries are the responsible for the things for absorb the fluid from the interstitial space, and it goes to the lymphatic vessels, and then it enters to the lymph node, and finally through the collecting duct it enters to the subclavian vein. So that's why we always said like lymphatic system is also is a part of circulatory system. The last point is that lymphatic fluids are enters into the subclavian vein. So you can see this picture for the right. We have two major ducts, the right lymphatic duct and the thoracic duct. So here you can see this right upper limb, right side of the thorax, right head and neck. So these areas fluid will be directly goes into the right lymphatic duct, and the remaining parts it goes to the thoracic duct. Okay, clear? So this is the flow chart. From the interstitial space, the lymphatic capillaries are absorbing the fluid, and then it goes to the lymphatic vessels, and then it goes to the lymph node. Through the lymphatic vessels, it enters to the lymphatic trunk, and then it goes to the collecting duct. Through that, it enters into the subclavian vein. So how the lymphatic system works? The lymphatic system circulates protein-rich lymphatic fluids throughout the body. We all know that. It might be contains bacteria, virus, and waste products. We don't know what all things is into that lymphatic fluids. So it is a protein-rich lymphatic fluids. It might be contains bacteria, virus, and waste products. Then what happened? There is a connection between arterial capillaries and venous capillaries, right? Then there is a chance of oozing out the fluid. That fluid will be absorbing with the help of a lymphatic capillaries. Then it goes to the lymphatic vessels and then it enters into the lymph node. Okay, so the lymphatic system carries through the lymphatic vessels and it enters into the lymph nodes. What is the major function of lymph node? The major function of lymph node is filter out the harmful substance from the lymphatic fluid, right? So there are lymphocytes. They are the responsible person for fight against the bacteria. If there is any bacteria there, so the lymphocytes will be trying to fight kill the bacteria there, right? Then the waste are flushed from the body and the clean lymphatic fluids drains into the bloodstream. So this is how our lymphatic system functions. What is lymphedema? So lymphedema is a pathological accumulation. So now we all are clear about the anatomy of lymphatic system. Now we are going to learn about lymphedema. So lymphedema is a pathological accumulation of protein-rich lymphatic fluid into the interstitial tissue space due to an imbalance between the interstitial fluid production and transport. So there is an imbalance between the interstitial fluid production and transport. So here what happened is the production will be there, the transportation will be difficult. For example, if a person develops carcinoma breast, usually what are the treatment? They need to undergo the surgery because we need to do the total mastectomy. What is total mastectomy? Removal of breast and the adjacent lymph nodes, right? If we remove adjacent lymph nodes, our idea is good because we need to prevent spread the infection, the cancer from one area to another. For that, we used to remove the adjacent lymph nodes. So we remove the adjacent lymph nodes. So there is no axillary lymph nodes after that. But the production will be there in the arm all the time. Because the arterial capillaries and the venous capillaries are communicating together. Because of that, the fluid production will be there. But the transportation will be affected because we already removed the adjacent lymph nodes. Right? Clear? Clear? So there is a chance of accumulation of fluid into the interstitial tissue space. So that is called lymphedema. Clear? Coming to the classification, there are two major classifications, primary and secondary. So primary is the congenital lymphatic dysplasia because of the congenital abnormalities. From the birth itself, there is a malformation. So that is primary. The secondary again divided into two, anatomical obliteration of the lymphatic system. Okay, clear? The secondary part again divided into two, so non-malignant and malignant. So from this slide, you have to understand that non-malignant persons can also develop lymphedema because if the persons have a major road traffic accident, so that time might have affected a big lymph node. For example, in just imagine femur bone fracture. So that time there is a chance of inguinal node affected. So that persons gradually can develop lymphedema, burns, infections, recurrent infections, cellulitis. and then hydrogenic surgery and radiotherapy. So these all persons can affect lymphedema, can develop lymphedema later. And malignant primary lymphomas and secondary recurrence. So sometimes it could be primary or sometimes it could be recurrence. Coming to the diagnosis. So that is very, very important. Whenever you have seen a patient with edema, you have to take a proper history because all edema is not lymphedema. Clear? All edema is not lymphedema. If a person have cardiac issues, that patients might have developed lower lymphedema. If a person have a renal failure, that person might have developed lower lymphedema. If a person have a respiratory problem, that person might have developed upper part edema, especially facial edema and all. So we have to understand from the history what is the cause of developing edema. So you have to take a proper history. You have to be a good listener and understand the cause of edema. And if you take history, you have to understand that whether there is any unknown cause, whether there is any disease related or trauma related, whether there is any treatment related. So these all things you have to keep it in mind whenever you have to take a history. And then you can do the clinical examination. So if you take a proper history, then you can understand whether the patient is having lymphedema or not. Then if you decide this person is lymphedema, then you can do the clinical examination. So again, there are 4 stages. The stage 1 is stage 0, 1, 2, and 3. Okay. Stage 0 is no edema, the patient is having cancer, mastectomy done, but there is no edema. That is stage 0. Stage 1 is, it looked like a pitting edema stage because like it looked like a orange peel skin. If you apply your finger pressure on that area, you can able to see your finger points. So that is the stage 1 pressure, stage 1 lymphedema. If you have seen this stage, you can able to manage this patient. You can able to control this edema soon because we need very minimal time to reduce the stage 1 lymphedema. So then this is the stage 2. If you have not given attention to the stage 1 lymphedema, then it goes to stage 2. That time the tissue have become fibrotic, little bit hardened, and tissues are no longer soft. This is the stage 2 lymphedema. And the next stage is 3. The tissues are considerably hard and cartilage formation will be there. Sometimes creases formation is also. So that is stage 3. So this is Temerson. For a healthy person, a fold of skin can be pinched and lifted up at the base of the second toe or a middle finger. For a normal person, it can be. For an lymphedema patient, you cannot lift out the pinch of the fold of the skin of the middle finger or the lower part, second toe finger. So the stemmer signs are present is a positive sign of lymphedema. It is indicated the lymphedema when the skin fold cannot be raised. Inability to pick up the fold of skin over the proximal phalanx of the second toe or the middle finger. That is stemmer sign. Clear? So the other diagnostic methodologies are soft tissue imaging, MRI, CT. If you can do these things, you can able to determine extra fluids. Lymph vessel imaging, then you can able to detect abnormalities. Then again bioimpedance spectroscopy, then you can able to measure the interstitial fluid volume. So For a palliative care patients, we will not do these kind of diagnostic procedures because no need to spend much money for these kind of investigation because through the history we can understand whether the patient is having lymphedema or not. And there are, when I mentioned earlier, because the primary stage lymphedema, that is anatomical, not congenital abnormalities. Clear? Congenital. So if there is any congenital abnormalities there, we need to find out the cause. For that, you can do this kind of investigation. But for a palliative care patients, for a cancer patient, no need to do this kind of investigations and no need to spend money for doing these kind of procedures. Problems. So pain and discomfort. Just discuss about the physical problems first. Pain and discomfort will be there because of the fluid volume. Maximum our skin will stretch. After that, pain and discomfort develop. Tightness, they may feel tightness, heaviness, they will not be able to move their that affected arm or limb independently. Fatigue will be there, numbness will be there, and impaired mobility, loss of functions. These all considering physical problem. So these are connected with the emotional issues also. If they are not able to move their limb independently, they need to depend others. That will be affect the patient emotionally because of the disease. I'm not able to move my limb independently. I need to depend others. And then they will, that thing will connect to the spiritual issues also. What they are thinking. So why God punished me like this? So these kind of things will be there. And coming to the psychosocial problems, body image. So one limb is normal, the another limb is not normal, is abnormal because of the fluid volume. So it they will be that will be affecting the patient emotionally because I have seen many patients, nobody is willing to expose their lymphedema part anymore. So they always cover that lymphedema area with their clothes, their shawls. So they usually bring long that shawl with them or long towel with them. So they used to cover that affected limb all the time when they come out from the home. So if they exposed to the public, what happened? So everybody is asking too many questions. What happened? What happened? So they need to that give a reply to everyone. So because of that, they usually cover the upper that affected area from the public that areas, and then loss of independence again, that will be affecting the patient emotionally. Loss or change of employment because of the disease, they are not able to continue the treat the employ that continue the job. So that will be affecting the patient emotionally. Difficulty in wearing clothes and shoes because the limb is one limb is normal, the another one is bigger. So not need no way to wear a shoes, and then wearing clothes. So if they want to wear a ready-made clothes, they will not be able to. They will be in anxious, and if you don't give a much attention to the anxious stage, that patient it goes to depression because they will be anxious about their disease, and because of the edema they will be thinking like my disease is spreading to my arm also. So the constant reminder of disease is also there. So what you have to do is you can do the individual assessment and also you have to understand the insight about the patient because they might be thinking like we know how what is lymphedema because there is no lymph node, there is an accumulation of fluid into the lymphatic that area affected area. So that is why the patients have developed lymphedema. but the patient will be thinking like my disease is spreading to my arm also. You have to understand their insight and then make them understand that what is lymphedema, what are the ways to reduce these kind of edema. These things you have to tell them. Then coming to the management. So anybody tell me how can we reduce this edema? Now we
Elevations and all.
very good. Skin care is very, very important. You have to give a proper education about skin care and then pressure
Diet
band. Now you
control,
mentioned
ma'am.
about
So
yeah, pressure
excessive
bandages. Okay,
protein
you
and
can
fat
wear.
accommodations to keep in diet control.
Okay, but diet control.
No.
What
Diet.
what? Oh yeah, what kind of diet you advise?
They try to avoid fat-rich food, ma'am.
Is there any connection between that?
For
Ma'am,
excessive,
diet should be according to comorbidity like DM, hypertension, everything is there. So depending on that, the diet has to be controlled with SRD or DD diets and all.
Yeah, I agree with that. Definitely, if there is any comorbidities there, definitely we have to give a proper diet advice. But for lymphedema, I don't think no need to give a dietary advice because they can take anything. So
Yes,
this is
ma'am.
not a connection between diet and this part. So I think Rajeshwari, no need to give an advice on diet.
yes, okay, ma'am.
Mild massage towards down part from if it is on the leg towards the thigh,
Okay.
mild way of massaging.
Okay. So we can give a, I'll come to that later. We can advise the patient on skin care. We can advise the patient on massage. So before advice, you have to understand that what kind of massage you can educate. And then you can apply some pressure bandages and then exercise. So these are the four principles of management of lymphedema. One is skin care, and the another one is massage, simple massage, and the third one is compression bandages, and then exercise. So these are the four principles of management of lymphedema. And another option is intermittent pneumatic compression pump. So I have seen that. Intermittent pneumatic compression pump when I was working in the regional cancer center. So I'll explain later that part. These are the four principles of management. Before going to the management part, you have to take a proper measurement because measurement, you have to take a proper measurement and also you have to do the proper documentation so that we can able to compare the maybe after if the patients come after 2 weeks, you can able to take a re-measurement and then you can see whether there is any changes for your treatment. So after your treatment, if there is any changes there, you can understand from the measurement. So you have to document it well. So give a comfortable position to the patient. You have to support the arm with give maybe you can keep a pillow under the arm or you have to give a comfortable position. And for the upper arm, you can take measurement from the head of the ulna plus 2 centimeter. You have your first measurement from the head of ulna plus 2 centimeter. Okay. And then you can take every 4 centimeter. From the first point would be the head of ulna plus 2 centimeter. That is the first point. And then from that area, divide every 4 centimeter. You have to mark it down first and then you can take the measurement circumference. And then for the lower limb, ankle joint from the ankle joint plus 2 centimeter. That is the first point. Then every 4 centimeter. I have a video on that. I'll show it to you later so that you will get a good idea about that. And then coming to the skin care. So that is very, very important because if there is any infection develop into that area, that patients might have developed cellulitis because there is no lymphocytes. We already remove the lymph nodes from the axillary area or inguinal area. So there is a chance of developing infection. Always you have to educate the patient about a simple moisturizing cream just after the bathing, not just before the massage. Clear? Not just before the massage. After bathing, they can apply simple moisturizing cream for prevention of dryness. Second thing is the in between the digits, there is a chance of accumulation of dirt into that part. There is a chance that part. If the dirt is accumulated, there is a chance of developing fungal infection. Avoid injections when you puncture. Avoid razor sets. So these will be affecting the patient because if you do it in a wrong way, if you can give injections, there is no wrong. But if there is any maybe unhygienic practices, we always used to give injections as a aseptic technique, right? If there is any that chance of infection develop, then there is a chance of cellulitis. So that is why we used to tell the patient to not take injections or venipuncture that area. If there is a lymphedema area there, you always try to avoid that area. And avoid blood pressure cuffs also. If you apply blood pressure cuffs, that will be affecting the collaterals. And avoid injury. If there is accidental injury happen, what they have to do is they have to keep that area clean and dry. If there is any chance of, if they have seen any signs and symptoms of infection, they have to take an antibiotics immediately. Otherwise, might have developed the cellulitis. So that is one of the major complications. Avoid carrying heavy the weights also. If they take heavy weights, what happen? Again, the circulation will increase. If the circulation will increase, what happen? The capillary filtration will increase. If the capillary filtration increase, what happen? The edema will increase. So these are the skin care. Massage. The second principles of the management of lymphedema is massage. Massage is divided into two: manual lymphatic drainage and the simple lymphatic drainage. So this is very, very important. Manual lymphatic drainage is done by a trained professionals. Okay? Manual lymphatic drainage is done by the trained professionals. Either a nurse or a doctor or a physiotherapist can do the manual lymphatic drainage. But the simple lymphatic drainage, you can teach the caregivers or you can teach the patient or you can teach the volunteers. Because we know the interstitial fluid are situated in the lymphatic fluids are situated in the interstitial space. We know this gentle pressure is enough to move the fluid from one area to the next area. But the caregiver or the patient doesn't know how much pressure is applied for that area for moving the fluid from one part to another. If you teach the caregivers or patient for massage the affected area, they will give more pressure. After that, there is more chance of developing edema. Because when we talked about pressure sore prevention, we used to tell like we have to instruct the patient caregivers about the importance of massage. Why? There we need to improve the circulation. There we need to improve the circulation for preventing pressure ulcer formation. Here, if you give more pressure, the capillary pressure will increase, right? The capillary circulation, arterial capillaries and the venous circulation, that capillaries circulation will increase, right? So that there is a chance of more leaking out of fluid into the interstitial space. So here there is the gentle massage, gentle pressure is enough, but the caregiver doesn't know. So what we have to do is you have to tell the patient about to start a deep breathing exercise. So if they take a deep breathing exercise, all lymph nodes will be stimulated because we have around 600 to 700 lymph nodes in our body. If you take deep breath, all lymph nodes will be stimulated. This is a warning signal because they will be ready to collect the extra fluid from that another part, because that we need to stimulate the deeper lymph nodes and then stimulate the superficial lymph nodes. Example, neck nodes, axilla, groin. These are the superficial lymph nodes. So you have to stimulate the neck nodes. You have to stimulate the supraclavicular node. So wherever we have a superficial lymph node, there a pathway and then you can try to push the fluid from the affected area to the non-affected area. So I have a video on that. I'll show it to you. Then stimulate the unaffected node, because if my left hand is affected with lymphedema, then you have to stimulate. There is no lymph node in my left hand. And they will be able to collect the make a pathway and try to massage the proximal part to the distal part. So you have to clear the proximal area first and then go to the distal. Lymphatic drainage contraindications are acute cellulitis. So if the patient is having acute cellulitis, we know if the patient is having warmth will be, these are the signs and symptoms of infection. So if you have noticed these kind of symptoms, you should not give an active management. Clear? And then renal failure. So you are going to push the fluid from the affected area to the non-affected area. So if there is renal failure there, they are not able to receive these kind of fluid because again that problem will worsen. If unstable hypertension there, then you have to avoid severe cardiac insufficiency, hepatic cirrhosis with abdominal fluid because arthritis and superior vena cava obstruction. So these are problems, the conditions you have. You should not give an active management, because if the patient is having superior vena cava obstruction, what happened? So the patients might have developed breathlessness because there is already the obstruction there. Then you are going to push in fluid also. So there is a chance of overload. Through that, the patients might have developed breathlessness. So we can watch a video on manual lymphatic drainage now, and then move to the next part. Sangeet?
Okay, ma'am.
Ma'am,
Yes.
yeah, actually, one of my patient, ma'am, which I have done a presentation also for that. She was an advanced case of bilateral CA of both bilateral breast, with
Hmm.
involving the axillary lymph also, plus her cervical lymph, ma'am. And she has developed this thing, lymphedema of that left arm, because that involvement of the right breast was also there. Her left was already with the fungating wound, and she has developed, means it progressively, like vigorously increased, because when they referred for home care, it was vigorously increased with her lymphedema. We have tried like this thing massage, but my question was that, ma'am, like involving all this lymph node, like neck also involved, axillary also involved, so how to drain out the lymphatic fluid drainage, ma'am? We tried with the mild massage. I used to give, I used to bring it and try to take it after stimulating on the, which was little bit of left right breast, which was good. So that auxiliary, but that also got in a, within a, it was progressed very fast. Within a 4 months she's passed away. So 5 months like she was at home only. But the thing is that, ma'am, that to take it from the chest wall, I was little worried till the groin to take the massage, like slowly upper up, like, ma'am.
Yeah.
What is?
Okay. Thank you for brought out the patient story here. So here, what we can do is deep breathing exercise you can advise. Uh,
She was meds to the lungs also, ma'am. She has reached with the meds to the lungs. Deep breathing
no,
also
no
to her.
issue. And if possible, you can take advise her to take at least 2 breaths, 2 deep breathing exercise, because I know this patient is affected the metastasis into the lungs also. She is not able to take more than 5 deep breathing exercise at a time. So you can advise in that case, you can advise at least 2, so that all internal lymph nodes will be get stimulated without
Mm,
massage. And then
mm,
do one thing, you can stimulate the groin area, inguinal nodes, and massage that lymphedema to the lower part. And
mm,
ask that after massage, you can advise the take again. You have to advise the patient to take deep breathing exercise and elevate the lymph.
mm.
So that's
Okay.
that way we can able to manage. I have seen these kind of patients in our settings too. We
Mm.
manage like this. Thank
Okay,
you.
ma'am.
Thank you. Any other questions? Okay, then we can move to the bandaging part. So I already said there are two different types of massaging: manual lymphatic drainage and the simple lymphatic drainage. So the manual lymphatic drainage is done by a trained professionals. So that is why so I have shown this video. This is for the man. This is the manual lymphatic drainage. This is for the trained professionals. If there is no trained professionals are available, or if there is no if the patient is not willing to admit it into the hospital, what you can teach is you have to train the patient and caregiver about the simple lymphatic drainage. For that, you can explain, instruct the patient to take deep breathing exercise. That is no contraindication. Ask the patient to take deep breathing exercise. The only difference is they should not touch the affected part. They should not touch the affected part, but all other things they can do. They can take deep breathing exercise. They can stimulate the superficial lymph node. They can stimulate the unaffected axilla. They can apply bandages. Again, they can take a deep breathing exercise, but they should not touch the affected area. That is the major difference between the simple lymphatic drainage and the manual lymphatic drainage. I hope this is clear to everyone. Okay. So after massaging, you can educate the patient to wear bandages. So we have that stockings also. So if there is the edema is uniform, then you can advise the patient to wear stockings. But the contrary, the one major advice you have to given to the patient for wearing stockings is they should remove the hosiery or stockings at night, because there is more that the elastic power is more in the stockings. So when the edema reduce, that will irritate, that will constrict the tissues. That pressure, the pressure will be more in the tissues, and the tissues, underlying tissues, may not get adequate blood supply. So if they are using stockings, they have to remove at night. If they are using crepe bandages, they no need to that, they no need to remove at night, because when the edema comes down, the automatically the crepe bandages are loosened. So if they are wearing crepe bandages, they can wear it. They can just during this night also they can wear it. So during the initial stage, what you can suggest is you can give a spiral bandages. Spiral bandaging means 50% overlap. 50% overlap. You can able to teach the caregivers also. They can easily learn about 50% overlap. So one is easy learning. The another one is the toleration. The patient, if you go with the figure of 8 bandages initially first, the patients will not be able to tolerate that much pressure. So you have to tune that patient. So you have to give a spiral bandaging first, and then after 2 weeks, you have to check whether the patient is able to tolerate the spiral bandaging. Then you can think about the figure of 8 bandages. We need to give more pressure on that area, but initial stage it may not be possible. While doing bandages, you should not cover the fingers, the nail buds, so that we can able to that check the obstruction also. If you apply more pressure on that tissues, you can able to see the blood circulation sinus, that bluish discoloration there. If there is any obstruction there, definitely the nail will show the bluish discoloration, so that we can able to remove the bandages. So you should not cover the nail buds. And the second thing is, you should not fix the bandages with the clips, the metal clips which we already get through the crepe bandages, that bottles. You should not apply the crepe that clips for fixing the bandages, because that metal clips will irritate the tissues. Sometimes that will poke the tissue, so that the patients might have developed infection. So you have to fix the bandages with the help of a micropore. And then for upper limbs and lower limbs also, you have to give bandages is the same way. Before applying crepe bandages, you have to give a cotton bandages for the protecting the skin. Sometimes the crepe bandages will allergy to the patient, so we need to give we need to protect the skin, as well as you have to give a foam pressure to that area also before giving a crepe bandage. So that for that you have to give a cotton, that is thin cotton layer bandages before applying crepe bandage. I have a video on that also. I'll show it to you later. And so I think Sangeet, if you are ready with the bandages, then bandaging video, then we can show that.
Okay, okay.
Anybody have any doubts? So I have few more slides. I think I'll finish this first and then take your questions. So after bandaging, you can advise the patient to take exercise. They give exercise If they are able to do it, you can encourage the patient to take do a simple exercise, or if they are not able to do it, then you can encourage the caregivers to give a passive exercise. So our aim is to move the fluid from the affected area to the non-affected area, because for that we used to give a massage and compression bandages, and then that exercise. So simple exercise, always you have to educate the patient about simple exercise, and always they have to wear compression bandages during exercise, and moderate the simple exercise is enough. So you have seen that video, in that video. So for one for their shoulder, one for their elbow, one for their wrist, and one for their fingers. So or when we give bandaging, you have to that give a give you can just put one or two that dressing pads into the incubital phase, that spaces, because otherwise there is a chance of accumulated fluid into that cubital fossa, right? So that is why we keep the dressing part while we that applying the crepe bandages. So always you can give a figure of eight pattern into the that elbow area, so that the movement will not be restricted. And the another important thing is you have to educate the patient about the elevation of limb. After bandaging and exercise, they have to elevate their affected limb with the help of a pillow, so that the all fluid will easily drain out from that affected area to the non-affected parts. So this is about the intermittent pneumatic compression pump. This is we so I have seen in the regional cancer center. So this is for the stage 1 lymphedema patient, because there is a stage 2 lymphedema and 3 lymphedema. It will not be possible, because these will give a continuous pressure. You will have to insert your affected lymph into that intermittent pneumatic compression. That plastic garment like things will be there, like that BP apparatus cuff. So then we can able to minimize the adjust the pressure, and duration also we can fix it, and they'll give that machine will give a continuous pressure. Okay, so that all the fluid will push from one area to the another part. There are two major complications of lymphedema. One is cellulitis, and the another one is lymphoria. So cellulitis is acute inflammatory episode. So for that you have to give antibiotics. If you have seen any signs and symptoms of infection like cellulitis, signs and features, there you have to educate the patient or instruct the patient to take that opinion from the physician, and at least to take an antibiotics for that. Amoxicillin is one of the good medication for controlling these kind of infections. After that, this stage you should not give try any active management. So once the cellulitis is reduced, then you can give an active management. The second complication is lymphoria. Lymphoria means leakage of lymphedema, the lymphatic fluid from the lymphedema site. So for that, we what you have to do is you can apply a non that adherent dressing pad into that area, and then you can apply crepe bandages. No contraindication here, so that all extra fluid will drain out through that area. So here, no, that active management is not restricted. But in case of cellulitis, no need to give an active management. For that time, you have to give a proper antibiotics and that treat cellulitis. Thank you. Any doubts? So unfortunately, we don't have any case presentation today. Anybody have any doubts? Please ask.
Well explained.
Thank you.
Ma'am, I have a doubt.
Yes.
When the swelling, I mean the lymphedema is there, when the blisters forms also we can apply the bandage?
Yes, yes. But, blisters. If there is the ulcers there, blisters is ulcer. Then you have to treat that ulcer. But lymphoria is that through the skin, the hairy follicles, hair follicles. Through
Yeah.
that, there is oozing out of fluid. There is no injury. There is no breakdown. Only oozing out of fluid will be there. No, that open injury there. If there is blister formation there, there will be a chance of ulcer. So then you have to treat ulcer.
Okay.
If you apply rub bandages, again that wound will worsen.
Okay. Thank you, ma'am.
Thank you. Any other questions? So for the steps of massage, I think it might you have you felt some difficulty because there are more steps. What
Yeah,
you have to
little
keep it,
confusing.
yeah, what you have to keep it in mind is ask the patient to take deep breathing exercise. Wherever possible, you have to stimulate that superficial lymph nodes. Not all, sometimes you have to stimulate the superficial lymph nodes. For example, submandibular lymph node, supraclavicular lymph node, neck nodes, and then you can stimulate the opposite side of the unaffected arm. Then you can that clear the proximal part and then clear the distal part. So that way you have to practice. So always instruct the patient to take deep breathing exercise before and after. So that is must. Okay. If
Okay.
you don't have any questions, we can wind up.
Okay.
Thank you.
Thank
Beautiful
you, ma'am.
class.
Thank you,
Wonderful.
ma'am.
Yeah. Presentation. Yeah. Good.
Thank you, ma'am.
Thank you, Sheeba ma'am, for the wonderful presentation. Thank you all for participating. Thank you. Let's see you in the next session. Bye.